We are going to speak now to our general practitioner, and this week we'll be focusing on our men, and our topic is prostate cancer, and we'll be talking with Dr. David Kerr. Yes. Doctor, are you there?
Hi, good morning. Thanks for having me.
Okay. Doctor, are you a general practitioner or you are a specialist?
I'm a general practitioner.
Okay. And you're going to be dealing with prostate cancer, right?
Can you repeat that?
And we will be talking about prostate cancer.
Yes,
Yeah.
that's what I want to talk about this morning.
All right. So it is common among the men. What is prostate cancer?
All right, so as I said before, morning to you and morning to your listeners, and thank you for having me this morning to have this very important discussion on prostate cancer. Are you hearing me?
Yes, man, I'm hearing you. I know it's very prevalent in Jamaica, very prevalent.
Yes, very prevalent. But as you said, what is prostate cancer? So cancer is when you have uncontrolled cell division in the body. You know, cells make up the body, and once it begins to divide and uncontrollably, that can lead to having cancer.
Okay.
And so therefore, prostate cancer, you have this uncontrolled cell division in the prostate. And you find the prostate below the bladder in the body, right? And the prostate is very important. It has a very important function to providing fluid for semen. And, you know, semen is vital for the survival of sperm, which is needed to fertilize the egg in the females, and that's why you get babies. So the prostate gland provides a very important function.
Is it that which is responsible for should I say running the sperm when they have a slow sperm count, or the sperm is slow to move to get to the egg? Is it the prostate is responsible for that?
Sorry, can you repeat that question?
All right. You know that you men have a problem with their sperms going to hit the mark. Yeah? Mm-hmm. So it is said that some men have slow sperm count. Mm-hmm. And I'm asking you because you said the prostate is responsible for the semen that carries the sperm. So is it that causes the sperm to be slow, to move slow?
Yes, so it can help to contribute to a low sperm count. So therefore, if the gland isn't working effectively, it can contribute to it, yes.
Okay, all right. So who does it affect? What age group does it affect?
Okay, very important question. And so generally, of course, you find a prostate gland in men. So it's a disease for men, and it normally affects older men. So you find that men over the age of 50, the average diagnosis is between the ages of 65 to 74, right? But very importantly, according to the Jamaica Cancer Registry, prostate cancer is the most common cancer in men and the third most diagnosed cancer overall. So as you were saying before, it is very common and it's something that we need to be aware of. In addition to that, a further study done by Mayhew, Aiken, and Morrison in 2014 stated that actually the Caribbean on a whole has the highest mortality rate of prostate cancer, and Jamaica at the time had the highest incidence of prostate cancer in the world. Can you believe it? So it's something that we need to be aware of, because especially for black people, we're at more risk of having prostate cancer as opposed to the other races. So it's something that we need to be aware of in terms of detection and treatment.
So, David, being a gallus don't contribute to having prostate cancer?
Being a gallus? No.
I thought that was the reason,
No, that's not the reason. It's, as you know, in terms of the risk factors, certain risk factors are being black, as I said before, being at an older age. Other smaller risk factors include smoking,
yes,
as well, and certain studies found that certain diet choices, like high-fat dairy
yes,
and red meat, can make you more prone. If you already have the cancer, it can make the cancer grow faster. So those are other risk factors.
So, doctor, the size don't have any effect on the prostate cancer? The size of the penis, the size. Does the size contribute? Yeah.
Oh, no, there's no studies really to suggest that. No.
Oh, okay. I thought it was the size and the gallus thing,
No, no, not at all.
So what are the symptoms then of prostate cancer?
Okay, so for prostate cancer, in the modern age, because the testing for prostate cancer are encouraged for men as they get older. So we find that sometimes what we call it is an incidental finding. When it's incidental, they may go to the doctor for another issue, and then because of certain examination and tests that the doctor does, they find that you have prostate cancer. So normally early on in the cancer, you don't have any symptoms. Really, when symptoms start to show on is later, we'll call it advanced stage of the disease. So you start having, at this stage, you may have weight loss.
Okay.
You may have bone pain. Your blood count may be low. You may start having urine problems in terms of holding urine. You may have blood in the urine.
Okay.
You may have frequent urination. Just to name a few.
So, David, erectile dysfunction is not a symptom of prostate cancer?
Yes. Yes, definitely. That's another symptom in terms of like the late stage.
Yeah.
That can happen as well.
Wow. All right. So
a lot to take in, yes.
Yeah, it's a lot, you know. Mm-hmm. How does a man get tested for prostate cancer?
Okay, so this is the important part, and a lot of men don't like to hear this part.
No.
Even before I was a doctor, I heard about the dreaded prostate exam, but it's nothing to be afraid of, because all of us need to take responsibility for our health. And especially, as we said before, because of how common this cancer is, it's important for every man to take that responsibility. Say, okay, I need to get checked out. How you get checked out? It's normally combine two modalities. So you have a blood test that we call the prostate-specific antigen that measures the levels of this substance that's produced from the prostate in the body. So in addition to that, you do the digital rectal examination. The prostate exam, which a lot of men don't like. That's where we insert of course, we wear gloves, insert lubricant, and then we insert a finger into the anus to feel for any abnormalities on the prostate gland, because of where the prostate gland is located, it's easy for it to be felt once you enter through the anus. So combining that plus the blood test for the prostate, it enables us to give a good indicator of the patient's risk of having prostate cancer.
But David, we're in 2022. Are you trying to tell me no, haven't come up with any new way of doing the prostate cancer test?
Right. I really wish we could, but that is the most effective way in terms of a good indicator. It's cost effective. It can be readily done at any general practitioner's office, such as my office at Clock Tower Plaza. Can come. If you have a concern, I can write the blood test for you, do the examination, and then we'll take it from there. But right now, that's the first two steps that is recommended by the international bodies as a screening test to detect of your chances of having prostate cancer. But it's not just that alone. Your doctor will take a history and to find out some of your risk factors in terms of your family history as well, which is important. Because if you have, a first-degree relative that's, for example, your father had prostate cancer, that puts you at greater risk. If you're an older man, if you're having the symptoms, and then compare that with the examination that the doctor may do and the test ordered, all of that enables him to say, okay, we need to take the investigations further now. Because it raises the doctor's high suspicion that you may have prostate cancer.
Yes, Dr. Kerr, you mentioned earlier, and I mentioned as well, that prostate cancer is very prevalent in Jamaica. You know, the Jamaican men, them love them strong back, them juice, or them love drink. You know, yes. Could it be that could be a contributing factor, seeing that the Jamaican men, them love them spirulina and them strong back something?
You know, that's a good point. But currently, you know, we need to do more research in terms of the different bushes and the different substances, you know, that we like to take in Jamaica, into terms of even that could be a contributing factor. Because I agree with you, because of how high the incidence is. But right now, there's no studies really to suggest that. But that'd be a good idea for us to really look into.
All right, doctor. Can this form of cancer spread? What stage is prostate cancer once it starts to spread?
Okay, right. So, according to the American Joint Committee on Cancer, they stage cancer based on the cancer itself, which is they call the tumor, in terms of the spread to the lymph nodes and the spread to distant parts of the body, right? So it's not like a straightforward stage 1, 2, 3, 4, but so they combine all of those factors to determine what stage you are in the cancer, and that will determine the treatment going forward. Yes.
All right, you mentioned that it spread fast. Where does it spread fast to?
Okay.
To the penis?
So they found that, in terms of the cancer itself, it will be firstly in the prostate gland, and then it can spread to surrounding structures around the prostate, for example, the bladder. But they found also, and that would explain in it spreading to the bladder why sometimes they get the urine symptoms that they have in the frequent urination, you know, the burning, or, you know, if it penetrates into the bladder, you can get the blood. But also studies find that it can spread early to bone. As well. Bone is one of the first early places. So that's why sometimes in advanced disease they get that bone pain. Yes.
So, doctor, once you've recognized that is the problem, prostate cancer, how can you prevent the cancer from spreading once you found it out?
Yes, definitely. Important question. And it's important for us to know that although it's so prevalent, it's actually a very slow-growing cancer. So therefore, that's why, you know, testing is important, screening, finding out as early as possible. And when you do, you can use treatments to prevent the spread of it, right? You have many treatments that you can use to prevent the spread, and I guess we can go into the treatments now. So we spoke about the digital examination, we spoke about the blood test. So once the doctor does all of that, takes the history, say, okay, I have a high suspicion that this could be prostate cancer, then they'll go ahead and do a biopsy. Right? And that biopsy will take a sample of the tissue from the prostate to determine, okay, is it low-risk cancer or high-risk cancer? And then now they can start the treatment. So the treatment can be, for example, they can do watchful waiting, what they call active surveillance. So if it's low risk, they may just take a watch and wait approach, because, as I said, it's a very slow-growing cancer, and some of the treatments that they use for prostate cancer can be very damaging. You know, say damaging, you know, especially you talk about the Jamaicans or the strong to perform. It can affect the performance, can affect them having erections. So sometimes they say that, you know, if it's low risk, they can take a watch and wait approach to prevent decreasing the quality of life for the person.
David, you said the growth is slow. We, the female, have been told that we need to do a pap smear yearly. Are the men encouraged to do do you have a prostate cancer test yearly?
Yes, definitely. And I'm so glad you said, especially because of our population, because of how high the incidence is. It's important for men, from you reach the age of 45 to 50, you need to start going to your doctor and doing your annual or yearly prostate examination paired with the blood test. Definitely, I agree.
Wow. Yes. So you were telling us about how prostate cancer is treated.
Yes. Yes, so I want to follow up on that. So as I said, watchful waiting, and then once they decide to go ahead with the treatment, they can decide to remove the prostate gland in total if they find that the cancer hasn't spread beyond the prostate. Also, what they can do as well, they can do radiation therapy early in finding out the cancer. So they can do it either before they remove the prostate or after. Unfortunately, if the cancer has spread beyond the prostate gland, they can do chemotherapy, as well as they can give hormone therapy to reduce the level of testosterone in the body that can make the prostate cancer grow. So all of those are treatment that is normally done.
All right. So how can prostate cancer be prevented? Is it a lifestyle that gives it to you, or abstinence would be a good thing to prevent it?
Yes. So in terms of prevention, again, all about screening, in picking it up early. In addition to that, the diet. So as I said before, there's certain food, as I said before, the red meat and the high-fat dairy that can make you prone, if you have the cancer, for it to grow even faster. So you can reduce that consumption and eat more healthy. And not just for prostate cancer, it helps just for general well-being. Because even my tagline at my practice at Plaza is obtaining, maintaining, and restoring good health. And I believe in preventative medicine. And a part of preventative medicine is eating healthy. So eating more fruits, eating more vegetables, eating less processed meats, and eating less salt and sugar products, So all of that is important. And even going back to prostate cancer, eating more healthy and eating less processed foods can make a big difference.
Dr. David. Dr. David, Jamaican men have a culture of not wanting to go to the doctor. So I don't see how the doctors would be able to pick that up from early. Because the man them no want to go to doctor. What is the reason? What's the reason why your counterpart or your gender afraid of doctor?
Boy, you raise a good point, and there are studies to suggest that, because in other countries they find that they pick up the cancer earlier, before it starts to spread. But in Jamaica, a lot of the times we pick it up when it's spread beyond the prostate gland, which is sad. Why they don't like it? Again, there's a study done by Aiken, Mayhew, and Morrison, again in 2014, which found that they did a study to find out, why are we picking up the cancer late?
Yes.
And a lot of it is that Jamaicans just don't like that exam.
No.
With the culture that we have here, there's a fear of it. They don't like it. They also found other reasons, like, the economic reasons as well. But the main one is because, they just don't want that digital rectal examination. And it's important in allowing us as the doctors to pick up if you do indeed have cancer.
Doctor, you mentioned economic reason. You mean say there?
Repeat that?
You mentioned the economic reason why the men don't want to go to the doctor. And I'm asking you, is it expensive? Why that is a part of it?
Well, as I said before, in terms of detection, you can do it at a general practitioner's office. And most general practitioners are affordable. But, everybody's economic situation is different. So that's why that study gave a number of reasons. So some people may not have the money to go to a doctor. So, they don't do the yearly checking up and, checkup that they need to do. So one is economic, one maybe because of society and our culture of not wanting it done. Some is the fear of having it done. So that's a part of the reasons that they found.
Doctor, what is the percentage of it being recognized in a male? Could that be one of the reasons that if 90 or 100 male go and do the test, 80 or 90% is found to have prostate cancer? So there's that fear that they might have it?
Yes, I agree with you, and that's exactly right. Because as I said before, us being black and then being older, the chances are very high that they can't pick it up, and some of them don't want to. They just, what they don't know, I guess, won't hurt them. But that's not true, because you never know how the cancer will treat you and what effects it will have on the body. So it's better you know than you don't know.
So you mentioned food before, but is dairy one of them that the men should avoid?
Yes. Again, studies have found that high-fat dairy and red meat, they can help to increase the testosterone level in males.
Yeah.
And that testosterone level can help the cancer to grow if it's there already. So that's why they advise on reducing the consumption of those two categories of food, or if you are taking them.
Wow. So would you say that the men that you have examined, more Rasta is not found with it, as opposed to the bald man them?
I wouldn't say that. I would say that it's just a matter of, as I say, age is a big factor. You really find younger men having it. So you more find it in the disease of the older man. I don't really find any difference between the Rasta and the bald head. But I think it's more with those risk factors I mentioned before, with the age and the race, and in terms of diet and smoking and stuff. Yeah.
Okay. So being a vegetarian does not really help, or doesn't prevent you getting prostate cancer?
Well, that can be a big benefit, because, as I said before, studies suggest eating more processed foods, eating dairy, for example, can make the cancer grow even more if you do have it. So if you're eating a more healthy lifestyle, if you're eating a more vegan lifestyle, that can help. Not eliminate, I have to make that clear.
Oh, it doesn't eliminate it. Okay.
No, it doesn't eliminate, but you can reduce the chances, because, just in general, just having a healthy lifestyle can help you to reduce the chances of getting certain illnesses. But, there are other factors at play. Family history is a big one, or race. Certain things that we can't change, our family history, our race, just to name a few. We can't fight that, but what we can do of ourselves in terms of exercise and that, to try and reduce the chances, as well as to ensure that you go to your doctor and get your yearly checkup.
What about drinking, doctor?
Alcohol, yes. The studies suggest that if you reduce the alcohol intake, that can help to reduce, not to prevent the cancer, but again from making the cancer grow even more. That studies suggest that as well, to reduce the alcohol consumption.
Oh, so the color of the skin, the height, the size don't have nothing to do with getting the cancer then?
Repeat that?
The color, whether you're black or you're brown, doesn't affect how tall you are, does not affect you getting prostate cancer. It don't matter the physique then?
No, it's a matter of, as I said, for the race.
Yes.
Black people.
Yes.
In terms of the age. That's another big risk factor. Family history,
wow.
as I said before, as well as your lifestyle in terms of your diet. Those are some of the main risk factors. And we said smoking as well.
So tell me, Dr. David Kerr, with the female, right, if the female is found to have cervical cancer, they can get their womb taken out, right?
Mm-hmm.
So as the men, do they have any surgery that they have to do?
Yes. So as I said before, when they do the biopsy and they do other tests as well to determine, okay, is the cancer just confined to the prostate or has it spread? If it's just confined to the prostate, what they can do is to remove the prostate, what they call a radical prostatectomy.
Okay.
That's where they remove the prostate in total. And then they do other treatments as well to prevent further reoccurrence of the cancer. So in terms of the survival rate of prostate cancer, the rate is pretty high, because as I said before, it's a slow growing cancer, and once it's found early, it can be curable. So that's why, again, getting tested early, the screening methods are very important.
Oh, so they don't have to worry about castration then?
Castration is a possibility, but it all depends on the stage. That was normally done in the past, but they normally don't do that as much now.
Wow.
And the castration is when they remove the testicles.
Yes, yes.
They may do that. They may do that if because again, the hormone, the testosterone is released from there.
Yes,
so that's why they would remove the testicles. But what they actually opt to do now is to provide hormones to reduce the testosterone level in the body, so to prevent them from getting castrated, and using those hormones to keep the testosterone or hormone levels down. And again, that will help to reduce the growth of the cancer.
Okay. All right, Dr. David Kerr, thank you so much. And for anyone listening and they would like to know more about prostate cancer, how can they contact you?
Thank you so much, and thanks for having me again on this very important topic.
Yeah, I know it's clock tower.
Yes, and just to tell our men that, don't be afraid to get checked out. Your health is your responsibility, and you need to find out, especially because of the factors that we spoke about, it being so prevalent in Jamaica. It's better to know than not to know and get treated, because the survival rate of prostate cancer over 5 years, according to a study by John Hopkins, can be 100% for 5 years and 90% for 10 years.
Okay.
And 15 years can be 85%. So if you define it early, your survival can be very high. And to find out more about prostate cancer, you can call me.
Yes.
And my office number, that's 876-502-1437.
Yes.
Or 876-678-5215. You can find me at Clock Tower Plaza. That's on when you enter on the Hope Road entrance.
Yes.
Upstairs from Medicine to Pharmacy.
Okay.
As you enter through the gate on Hope Road.
Yeah, I know. Not across from the church.
Pharmacy,
yes.
Upstairs
from
Medicine to Pharmacy.
All right.
And we can have a discussion. Yeah, man.
Okay, David. Thank you, Dr. David Kerr. Thank you so much.
Yeah, thanks for having me. And have a good day.
I will speak again, right?
Repeat that?
I said we'll talk again.
Yeah, man. Definitely.
All right.
All right, thanks for having me.